Good afternoon, good morning, good evening. My name is Inon Elroy. I'm the head of the Israeli Economic Mission in New York. I would like to welcome you all. As the coronavirus continues to spread, our thoughts are with all who have been impacted. Especially in time of uncertainty, we must band together as a global community. On behalf of my friends at the Foreign Trade Administration of the Ministry of Economy and Industry in Israel and the Israeli embassies and consulate, I would like to welcome you all and to thank you for joining us for this session. Special warm regards to the dozen Italian experts that have joined us now, and thank you to Jonathan Hadar and his team in Milan. We hug you all and we wish for better times. These are challenging days. Sharing best practices as well as strengthening bilateral bonds are more important than ever. I would like to thank Eyal and IRC Sheba, a global top 10 hospital, for joining forces with us to initiate this webinar. Sheba has been treating corona patients in special wards for more than a month, making liberal use of digital health and telemedicine to get patients the care they need without putting clinical staff in harm's way. We'll be presenting their experience and methodologies of using innovation and technologies to fight COVID-19. In addition to Sheba, that will be represented by Dr. Eyal Zimlishman, 5 Israeli companies will be sharing the telehealth and remote monitoring solutions. Israel operates 44 missions globally. These missions are non-for-profit organizations that are aimed to especially bring together Israeli companies and global partners. 5 amazing examples of how Israeli technologies could help you to do a better and a safer job in this unfortunate case will demonstrate soon. Please feel free to reach out to us to find and to get inspiration for any other topics and sectors in any country that you're based in to explore the thousands of the startups and the companies in Israel. Please feel free to visit our global website. I wish us all interesting webinar and a fast recovery. Thank you. I would like to introduce Dr. Eyal Zimlishman, Chief Innovation Officer at Sheba Medical Center, that will highlight Sheba methods and best practices. Eyal, the floor is yours. Thank you.
Thank you, Inon. I hope you all can hear me. We wanted to use this webinar to tell you the story of what we've been doing here at Sheba in the past month or so. Let me take this down for a bit. And share with you the story of specifically telemedicine and why telemedicine is so important in these days of coronavirus. We actually think that coronavirus, with all the problems that we're facing, and of course the severity of the situation, also promises a lot of potential to really accelerate innovation in a couple of fields, and for sure telemedicine is one of those. So as we were expecting, for example, to have telemedicine play a critical role in the next decade in the world and become a driving force, we now understand that maybe through COVID-19, of course, it wasn't intended, maybe through COVID-19, this would actually happen much, much quicker than we thought because of the necessities of these times. What we're going to do today is we're going to share with you that story. I'll start by giving a brief description of Sheba Medical Center and what we've been doing here in terms of innovation at large. And then I'll ask Dr. Galia Barkai, who heads our telemedicine efforts here at Sheba, to go into some more details into our telemedicine program related to COVID-19. And then, of course, we'll hear it from the startups themselves, the ones that are actually carrying out the different solutions that play a critical role here in this age. If we could start with the presentation, and I hope you could all see our slide deck. Maybe a few words about Sheba Medical Center for those of you who are not as familiar with it. Sheba is the largest medical center in Israel, also called Tel HaShomer. Some of you may know it by that name. It's just under 2,000 beds, a large hospital by any standards around the world, And on campus, we have a very large acute care hospital, but also a rehabilitation hospital, a children's hospital, a cancer center, a women's hospital, and a large research facility, and of course an innovation center as well. Sheba has a very large footprint in the state of Israel. We treat about 1.6 million patients every year. Think about the population of Israel being 9 million, and it's a big chunk of that treated in one hospital only. It's a huge campus, as you see in this photo. We even have a lake we're very proud of. It's more of a reservoir, but we like to call it a lake. The campus is about 200 acres with right at the outskirts of Tel Aviv, again, for those of you who are less familiar with Sheba and Israel. Sheba has been really a major force in research in Israel for many, many years and has a global footprint in that regard, carrying out about a quarter of all clinical trials in Israel just at Sheba, with by far the largest research budgets. From research, we see innovation coming out, and specifically when we set out about 3.5 years ago at Sheba to take innovation to the next level, we wanted to be able to have a major impact on how healthcare needs to be carried out. We even set a vision of healthcare in the year 2030, and we decided we're going to work proactively into making that vision a reality. To do that and to have a critical impact on healthcare, we needed to come up with a strategy. And we came up with the ARC program that is based on 4 priorities. The first one is setting digital health as a focus, as looking at digital health as the main change vehicle that will take us to where healthcare needs to be 10 years from now. Sheba has been focused for many years on pharma and medical device, so we decided we're going to build a big capacity in digital health as well. And within digital health, you'll see in a second what we've decided to focus on. The second one was open innovation. It's a critical element of ARC, working together with startup companies, together with the industry, together with other partners to really, again, work towards a shared vision. Thirdly is international collaborations. We're working in an international world. We know this today, especially now with COVID-19, we all share the same problems, obviously, and international collaborations are critical. And so we've built this ARC community, international community, that has in it currently about 15 major academic medical centers from around the world, mostly in North America, but we have also a few in Europe, and we're looking to expand to other regions of the world, and we're looking for the best partners, again, who share our vision and passion for innovation, that want to work with us in this global ecosystem. And it's not just about academic medical centers, it's also about the large industry partners, the large corporates that are part of ARC as well. And finally, it's the innovation infrastructure, what is needed to actually take innovation to the next level, both in terms of regulations, also in terms of the data infrastructure needed, and finally, the physical infrastructure. And you see in this photo here how our innovation campus will look like in the year 2025. Already 2 buildings out of the 5 are up and running, and now focused completely on COVID-19. If any of you want to come and visit, completely focusing on COVID-19, but this whole campus will be ready by 2025. When we talk about ARC and how the innovation actually works, we're looking at 4 levels of innovation. From our own idea lab, where we come up with our own solutions, where we have teams and funding that is devoted specifically to creating innovation. To the startups world, startups in Israel, of course, this rich startup ecosystem here is very unique, and we're looking for the best of the best. You'll see them here in a few minutes as they present, and they're a critical element of our operations. We devote a lot of attention to the development with the startup companies. Our strategic partners in the industry, companies like Microsoft and Johnson & Johnson and Boston Scientific, Merck, AstraZeneca, Baxter, Allscripts, Takeda, and others. And the academia. We work with all the major academic academic centers here in Israel, from Tel Aviv University to Technion to Weizmann and others. And then another element of that is the hubs that cut through the operations. And when we talk about the hubs, this is where we're focused currently. These are the areas we're focusing on. And on the next slide, you'll be able to see the hubs at ARC. On every day, this is what we work. Starting from personalized medicine to big data and artificial intelligence, virtual reality, augmented reality, the operating room of the future, telemedicine, of course, rehabilitation, These are our main 6 areas where we're focused on, where we have an annual plan and milestones we need to reach, really redesigning healthcare around these 6 areas that we're focused on. But then something happens. We got called by the Ministry of Health sometimes in mid-February, and we were told, listen, you know, there's this cruise ship off the coast of Japan. There are Israelis there. They were exposed to the COVID-19. I don't think it was called COVID-19 at the time yet, to the coronavirus, and we want to bring them back home. And we were chosen at Sheba to accept those, not patients at this time, but really people that were exposed to the virus. Some of them later developed the disease, but most of them stayed healthy since then. And this was the area where we needed to act, where we started focusing on this COVID-19 experience. And what we, and the next slide, you'll see that what is happening in Israel, it's not a very updated slide, but you could see, of course, just like the rest of the world, in terms of COVID-19 patients and the testing in Israel going up, the numbers have really climbed since then. And again, this is relevant, the numbers here for a couple of days ago. We had to come up with a plan. We needed to decide, first of all, is innovation essential or non-essential in times of crisis? And we made a decision, we're going into battle mode. For us at ARC, the decision to put aside everything else we've been dealing with, all of our activities in the 6 realms we've been focusing on, to put them to the side and focus currently only on COVID-19. We call it battle mode because that's what the state of mind needs to be at these times. We need to work very focused. We need to work very quickly. We need to work day and night to get solutions out that would make a difference in our fight against COVID-19. And it's not just about finding a new drug or finding a vaccine, which everybody's focused on. There are many, many other needs that we're going to need innovation to come in. And this is our game plan for COVID-19. It starts with mobile and some mobile applications that help us look at contacts between patients, contacts between staff, contacts in the population, and try to understand how the virus is moving from one to another, who's contracting the virus, where are we likely to see more people being contracting the virus later on. So mobile application is our first focus. The second is data. We're focusing on data, looking at data for COVID-19 patients and data from the population to come up with discoveries that might play a critical role in our fight against COVID-19. And for one thing, we're focused on very much currently on trying to understand which patients are going to develop a more severe disease. Can we predict which patients will need ventilation down the road versus which patients are going to only contract a very minimal disease with a minor flu-like symptoms. So this is a major effort we're focusing now in our data hub. Third is ventilation. We all know there's a problem with ventilation solutions. We don't have enough ventilators anywhere in the world. It's not something that only happens in Italy, but we see this in the US as well currently in some of the sites where that were hit stronger with COVID-19, and we're expecting that to happen in Israel as well. We're getting prepared towards that, and some of the preparation is coming up with solutions that will allow us to ventilate patients even though we don't have enough ventilators, and that's a major effort we're focusing on. We just came out of a mini hackathon just hours ago where we had 17 different solutions that came up to present to us ventilation solutions. Fourth is diagnostics. How can we diagnose the virus in a more quick fashion? How can we make sure it doesn't take us 2 days or 3 days to get the answer? And how can we do this in a much more cheaper and scalable fashion? And we're looking at a couple of options on this, several of them on the spectral diagnostic field that we think might play a critical role in diagnosing COVID-19 within a few minutes, within 10 minutes, getting a result of COVID-19 in something that you could scale up very quickly. I will move to therapeutics. We are focused on that as well. We have a few developments. We won't talk about that today, but there are a few developments in the therapeutic world that might bring some good news to our fight for COVID-19. But finally, of course, it's telemedicine. And within telemedicine, this is where we think this crisis has the ability to really push telemedicine very, very much forward. We've been talking a lot about telemedicine and where it is currently in the world and how much it needs to get to the next level. And it could be that this is our turning point, the watershed to actually taking telemedicine to the next level. And we'll share with you that, of course, in this webinar today. When we talk about telemedicine efforts, I'll move over to Galia to let you talk about what we're focused on and where we think we could play a critical role and where maybe we could bring some message to the world. Galia.
So, hi, I'm Galia. I'm head of telemedicine in Sheba in ARC. And I'd like to share with you a little bit of how we used our telemedicine platforms to tackle this problem of the coronavirus in several fronts. So the first one, of course, is how to give medical care for isolated corona patients, for isolated corona inpatients. So as Eyal told you before, we started by receiving to Sheba, admitting to Sheba the people that came back from the corona ship. And we found a facility that was distant and separated from our faculty, our hospital, where we wanted to put the patient, admit the patient inside and treat them from the outside. So we had a new challenge. We wanted to create a new concept. First of all, we wanted to give the highest level medical care that we're used to give in Sheba, but it was the first time we needed to treat patients with the need to protect our staff, and for that we needed minimal physical contact. And then we thought that we should harness telemedicine technologies in order to do three major things. The first thing, and the most important one, is to communicate with the patients, because we plan to stay out of the facility. The second is monitoring, and the third is physical examination. So, as I told you, it was a facility that was used as dormitories for students. So we had rooms in this facility with nothing special inside. We wanted to leave the technologies that were needed inside the room and then treat the patients from outside. So we made this zero contact model, and we inflated a tent outside of the facility where all the medical staff were there, and from there, they controlled everything inside. They had the monitors, they had the technologies there, the medical files, and they could do everything from the outside. So we called it the teletent, okay? So as I told you, the first thing was communication, and for communication, we used mostly Uniper technology. Uniper is an Israeli company that actually is Zoom-based, but it's a simple TV box that turns a television into a personal companion. It has a simple remote control that's really easy to use and has a built-in microphone, and it allows us to perform video visits very, very easily. From our experience, the patients use it with ease, and also the doctors and nurses. So we did video visits every day. We use it for group visits. And we even had a separate room where we put this technology for social workers and psychologists, since we understood it was very important for these people. In addition, we created a special family room. Family members, of course, were not allowed inside, but when they came to bring goods to the patients, they would sit in the room and they could discuss in group with the patients. So the other things we wanted to do is to monitor the patients. And for monitoring, we're using EarlySense technology. We use several technologies. One of them is EarlySense. EarlySense, I believe they will talk later. So I'll just say briefly that it's a sensor, contact-free, that monitors continuously heart rate, respiratory rate, and motion. But it also has an AI-based algorithm that predicts clinical deterioration. This is how it looks when they look at the trend and they see a deterioration. We know it for sepsis patients. We're trying to find out these days if it can be done also for COVID-19 patients. Another sensor we're using, and I will talk shortly, briefly about it, is BioBeat. BioBeat is also an Israeli technology that is, it's a small sensor that's put on the patient's chest and monitors all these parameters. Arik will be here and we'll talk about it more amply. This is how their dashboard looks. For physical examination, we used another Israeli technology that's named TytoCare. Tyto is actually a kit that helps us perform a physical examination it allows us to perform an examination of the chest and the heart, and also the ears and the throat. And they'll talk also later on how they were using their technology to help us treat these in patients. This is an example of how Dr. Gadi Segal is treating a patient using TytoCare technology. Another technology we're using is the InTouch telepresence robot. We found that the more complicated the patients became, we needed more, we used more this kind of technology, which allows us to better communicate with the staff inside and the staff outside. Later on, when we opened new wards in the hospital, because now we've already deployed a 300-bed facility for internal medicine patient, and we also opened a new Corona ICU unit. We opened a psychiatry unit, and go back. So this is our new Corona ICU robot, and for there, they found really helpful the use of the robot. If you see the picture on the left, you see their control room, which is actually much more sophisticated. And from there, all the staff that needs to take care of patients inside can look and control the robot from the outside and communicate with the people treating the patients inside. So this is one kind of effort, the medical care for the isolated Corona patients. But we also understood that the patients that would be not so sick would better be off at home. So we also developed a model for home hospitalization for Corona patients. So that was the other front we were dealing with. And I believe you'll talk also about that Datos, but for this we use the Datos Sheba application, which helped us to communicate with our patients while they're at home. How does it work? We built a system of levels of symptoms. At the first level, the easiest patients, we wanted to have a model that is scalable. So actually the patient needed just a temperature, to check just the temperature and the oxygen saturation 3 times daily. The application would remind them to do that. They would send them questionnaires regarding symptoms of Corona. And we would organize also a daily video visit by a specialist. And we put an on-call ID physician for consultation 24/7. For more severely affected patients, we had we created an extended program in which people will also check blood pressure. They would also use the Tyto for physical examination and possibly use continuous monitoring with EarlySense. The ones that would become more severe would have to be hospitalized in the hospital. So actually we had, that's what you saw. We constructed a zero-touch telemedicine toolkit, which includes monitoring, physical examination, and management. All this in one toolkit. The third thing that was really, really important to us is to allow our patients in the hospital that were not affected by Corona, to allow them continuity of care. So the other effort, the third effort that we did, was actually allowing our physicians and other staff to perform video visits with patients at home. So for that, we also used the Datos technology in a very, very simple, made very simple for the patients and the physicians to use. And I'm happy to say that since we deployed it about 2 weeks ago, we have more than 1,000 staff members using this technology, and we've already more than 500 video visits per day, and every day it's still growing. When I made the presentation, it was 700. Now it's already 1,000, and the video visits continue to increase daily. Our fourth and last telemedicine effort is, of course, in the area of research and innovation. We also deployed a few projects of research with several companies, allowing us to find out if we can use these technologies to better define the disease and monitor and predict a deterioration in patients with coronavirus. Thank you.
We will use the next 5 minutes for some questions that we received in advance. So I'd like to refer the first one to you, Eyal. What is the best way to get this technology to a hospital in Ohio? And I think it's very relevant to other hospitals as well.
Right. So we look at this toolkit as something that can be deployed in almost everywhere in the world. The idea is today, first of all, is to minimize contact, as we understand. And second of all, is to keep coronavirus patients who are mild patients outside of hospitals, because we need the hospitals to take care of the severe patients, and we know that hospitals can and maybe will become overloaded with patients as severe cases. So what that requires for us is to come up with a game plan that would allow us to do home hospitalization for mild cases. We know the vast majority of cases are mild, but the problem is that these mild, although they're mild cases, they might deteriorate fairly quickly. So we know that coronavirus patients can deteriorate in a matter of hours from a very mild condition to a life-threatening condition. And so even though they're at home and they're mild currently with very minimal symptoms, we still need to monitor them in a way that would allow us to identify the high-risk patients and bring them back into the hospital before they crash. And for that reason, we've built this in a way that's why we call it a kit. It's something that can be deployed almost everywhere. Some of the technologies are technologies that you could use the same technologies we've used or something comparable in other locations of the world. But basically, we think that this is something that was built with an idea that it's scalable and is relevant to everybody around the world.
The next one is for you as well. And the question is, have you found any interesting trends with the coronavirus patients tracking service, or is it too early? What do you expect to find?
Trends, I'm not sure I understand the question.
Trends from monitoring.
From monitoring.
Or is it too early?
So of course we've not seen huge numbers yet. We've seen maybe 150 patients here at Sheba altogether. But for sure, because this disease is mainly respiratory, and of course we know the problem is respiratory, the problem is in the lungs. What we're looking to see is most of the times respiration rate and saturation. It's critical to note that respiration rate always physiologically goes up first in these events. But by the time saturation levels go down, it's very late in the game already, and the patient is close to deteriorate. So you don't want to get to a point where saturation is already lower than 90, for example. You want to capture the patient in this condition when respiration rate starts going up. And this is why continuous vital signs and specifically continuous respiration monitors are very useful. That's one of the reasons why we're working with EarlySense, where there's very minimal involvement from the patient side that is required because it's a passive sensor under the mattress. So when you look at these trends, definitely when a patient deteriorates, you would see his respiration rate go up and you would see his heart rate go up. And then finally, you would see his saturation go down. And these are the signals you're looking for.
We'll move to you, Galia, and this one is for you because I think you gained some experience regarding non-tech savvy patients. So how are you using technology? What technology are you using for your patients that are not tech savvy? How are you supporting them, training them, provisioning devices to them? And I think you had to cope with this issue.
Yes. Well, in the beginning, we had a problem. We didn't know the patients before they came. We didn't have the way to train them in advance. We didn't even have the way to train the doctors using the technologies for the first time. So it was really challenging, but we did manage to do that, and we learned on the way. One thing that we learned is that we just, first patients, we left the technologies in the room. So we try to make everything as simple as it can be. Take out the passwords that are not needed, download all the apps that needed to be downloaded to tablets. And we needed a lot of from distance training from IT people that were dedicated for that. We found most of the technology, most of the things were doable with most of the people. But of course, as you all know, you have to make it as simple as it is possible to be simple. And some of these things are challenging. But for example, the Uniper, which is really simple, you just need to have a remote control and to turn on and off. This we found very easy to use, and I think all our patients were using it quite easily. We did some backups for communication because I was really afraid that they would not be able to use all these technologies. So we left them a simple phone in the room. We left them press buttons. We left them even cell phones that we gave them in the first place, the patients that were hospitalized in the facility. In that way, we could communicate always by phone and explain to them how to use the technology if they were a bit having some problems.
All right. I'll just refer the last question to you because I really think we've covered most of the questions you brought up during the session. So this one is more for you. Galia is also a specialist in infectious disease. And the question is if and how we control the infected people that recover.
If and how?
We control or track patients that recovered.
That recovered? How do we control them?
Yes, if at all.
The Ministry of Health controls everything. We are not allowed to dismiss patients until they have 2 consecutive negative tests for coronavirus. So it's all done nationally by the Ministry of Health. We do know exactly when patients become negative, and that's the way it's done.
Right. So with that, we will continue to the startup session with the first one being Datos. I'd like to invite Mr. Uri Betosh, CEO of Datos.
Hello. Hello. I hope everybody can hear me okay. Very good. Thank you for the Sheba team, and especially to Eyal and Galia. We've been partners for many years, and they help the company a lot in the developing of the remote, in the capabilities of the solution. I will start with what Datos is. Datos is a fully automated remote care and a telemedicine platform. We work with Sheba and other organizations here in Israel, but also in the US, providing remote care and telemedicine programs for different kind of conditions. When the COVID basically started, Galia and Eyal, they immediately started to design the remote care program for the COVID-19 patients on our platform. And that was the basis of the COVID-19 program that I'm going to present to you. And since then, the Ministry of Health of Israel actually contracted Datos to provide that solution to the entire Israeli positive COVID-19 patients to do home hospitalizations. in addition to transforming all the ambulatory clinics and the hospitals from face-to-face to virtual clinics. So what do we offer, basically? Datos today offer 2 programs for home hospitalization for the COVID-19s. The first one is home hospitalization, meaning that all positive corona patients are basically going onboarded on the same program and monitor their symptoms in addition to their vitals, in addition to video consultations with their physicians, and enable them to view contact, messaging between the care teams and the patients. And it is at the moment a fully configured program that can be up and running in a matter of 2 days. We already have the first live academic medical system in the US with 8 hospitals using that home hospitalization to monitor COVID-19 positive patients. And we are now deploying that throughout the entire Israeli healthcare to provide a clinical perspective on the entire patients on the national level. And we do that for the Ministry of Health with the help of the Sheba hospitals and the 4 HMOs that we have in Israel. The main advantages of such a system is to enable a large scale of care for in a very efficient manner. A lot of the program is being done automatically by the system, and only in special cases there is an alert for the physician. Basically, only when they need to jump on a video call with the patients. We also protect the hospitals and the care teams by isolating the positive COVID-19 patients at their home, and only the severe cases will be admitted into the hospitals. And also another thing that is a little bit funny, but we have in Israel, and I'm sure that all over the world, many medical teams that are being isolated, and they are sitting at home. And with our solution, we basically can provide care during the isolation period. And we all know that there's not enough medical teams at the moment. The second solution that we offer is transforming the hospital's ambulatory care to virtual. And we do that with a very, very simple solution. No app downloaded or any registration process is needed, which basically allow also to the support of non-techie users. And here I would like to pause for a moment, and I would like to talk a little bit about the difference between telemedicine in the COVID-19 versus telemedicine in the regular days. In the regular days, every patient has an option whether to use a telemedicine solution. Basically, it's an opt-in, or whether they would like to still using the face-to-face, or maybe to do emails with the doctors. Here in the COVID-19 situation, patients, they don't have a choice. It's either telemedicine or nothing. So what we did here is we lowered the bars from the technology requirements that we ask from the patients. So, for example, there is no need to download any apps. Usually we are not working with connected devices, although it is capable. We are capable to do so. We are not dealing with the pairing of the Bluetooth and a lot of other obstacles that connected device actually poses. And the idea here is to put together a program that will be easy to deploy in a large scale, very fast, and to support all patients, not only the techie ones. Since then, there were many articles about our solutions. As I mentioned before, the Ministry of Health, with the help of Sheba, basically contracted the home hospitalization program throughout the entire Israeli healthcare. And by doing so, we hope to prevent the overload of the hospitals. So what is Datos? Datos is basically a very flexible and robust platform that allow you to to deploy very quickly remote care and telemedicine programs. If needed, we also have the ability to work with connected devices. The patient gets an app that easily can be downloaded and can be personalized to their program. And all the data is being uploaded to our cloud, analyzed. In most of the cases, the platform can act on its own automatically. For example, when we have an abnormality measurement, we will ask the patients to measure it again, or maybe to rest 15 minutes and then to measure it again. We will send the patient surveys, either assessments or surveys or symptom surveys, and we can cross-reference the data between the vitals and the surveys. All the data will be transmitted into a very nice dashboard to the care team, but also supports the workflow in between the different care team members, support video calls and chats in between the care teams and the patients, and basically allow a large scale of management of the home hospitalizations of the COVID-19 patients. That's the way the system looks. You can see down in the bottom the symptom surveys, our mobile app, the telemedicine, the way that our dashboards looks in terms of managing a large number of patients in a very efficient manner. That list that you see in the middle of the patients basically being sorted according to the severity and the symptoms of the patients, allowing the care teams to focus only on the most acute patients and the ones that needed the attention the most. With that, I know that we don't have a lot of time. If there are any questions, I'm happy to address them.
Refer to some of the questions, and also I invite you to answer some of the questions referred to you at the chat, while we will be moving to the next session. So let's just take 2 questions or so. Let me start with the first one. How safe is the clinical data from the virtual clinic if there is no app for registration? Is everything anonymized?
Yes, so there are 2 options. One option is the home hospitalization. In that option, we do use PHI and PII. It is needed for the care teams to work directly with PHI. We're not going to ask them to work with translation tables on the side. It's really important for the efficiency of the process. On the telemedicine side of the virtual clinics, where we basically send text messages and ask them only to press the link, and they have video, and the video is open for them without downloading the app and without asking them for the registration process. On that option, we do not use any PHI, and we don't hold, even the phone number is not being saved in our platform. So we can both work either way.
Only one more question, and then I will ask you to go over the chat and answer the questions referred to you. So how can I immediately get Datos for my healthcare system and EHR system?
Just contact us directly. We will be happy to put together a demo system. From our previous experience in the US, we can be up and running in 48 hours. And happy to do a demo.
Please share your email contact in the chat, and thank you so much. We will move forward to Guy Megger, CTO and General Manager, VP R&D of EarlySense.
Hi, everyone. So I'll introduce you today to EarlySense. The EarlySense vision is to improve the outcomes using a contactless sensor and advanced analytics. We are visioning ourselves in the full continuum of care. The EarlySense solution is presented here. We can start with a sensor that is under the mattress that does not touch the patient at all. a bedside unit that is continuously monitoring heart, respiration, and motion. No need for any compliance by the patient. You could have that in two different form factors, with or without a screen, bigger or smaller. We have based our predictive AI models on more than 1 million patients database, including different rhythms, variability, shape, intensity of the signal, spatial patterns, variety of hospital setups and skilled nursing facilities. Our device will indicate via the remote view and control, which is the central station. We will indicate early with a very low false positive alert rate for the caregivers to drive early intervention. Just a moment. And thus we are able to improve the outcomes. We have proven improved outcomes both clinically and financially. Few words about EarlySense. We were founded in 2004, installed in over 250 hospitals and skilled nursing facilities, FDA cleared, CE approved, more than 32 patents granted, and the largest heart rate and respiration medical database. The outcomes that we see in a variety of clinical trials that have been published also in peer-reviewed papers includes in acute care hospitals, we see reduction in code blue events, more than 86%. We have almost half of the ICU patient transfer are being avoided, and we have about 10% less med-surg length of stay. In the post-acute care, we see reduction in readmissions and planned hospitals transfers, and the reductions of falls. So, what are the COVID-19 specific needs and how we help to meet those needs? So first of all, there is a major need in screening large scale of patients. It's preferred to do it in a contact-free way to avoid cross-contamination and without the need of the patient to comply and basing the decisions on data. We are able to indicate changes in patients with minor symptoms and say that they will go to the next level of care or illnesses. And when the patient is with symptoms like symptomatic patients, we can detect those patients that has high risk to deteriorate. We're able to help keeping caregivers safe and to minimal expose them to contamination. Our accuracy and respiration rate and the capability of detect changes in respiratory patterns and even detect patterns of labored breathing and respiratory depression are really suitable in respiratory diseases such as corona, but not only. And our remote view and control allows from the central station outside the wards to look at every bedside monitor, to change thresholds, to look into the trends, and to take decisions. We also have an easy implementation in a home-like environment, if it's hotels or isolated patients at home, etc. This is an example of, I cannot say too much things about patients, but this is an example of how it looks like when you are monitoring a patient that is changing its conditions. So you can see the heart rhythm goes, in this specific patient, the heart rhythm goes up. You can see indications, early indications of respiratory depression patterns. You can see that the patient eventually reaches high heart rate alerts and indicates, even though it becomes better here, it indicates also that there is another change to come, as well as trends within the respiration rate. Our solutions are suitable for the entire continuum of care. We have integrated our solution to Huron hospital beds. Every Centrella bed goes out with a sensor embedded with a display here and can run our software on their computer, on the bed computer. We have the EarlySense 2 and Insight that are usually used in hospitals, depends on the department and the taste of the customer, what serves him better. And in the post-acute care, we usually have Insight, but we also have a solution to move our solution to the home environment. We are able to connect our system to a cloud and to allow cloud-to-cloud API in order to manage a large number of patients. As you can see here, this is how the remote station looks like. We usually deploy that in hospital and post-acute setup, usually per ward, and the home solution can be integrated to front ends and back ends of other vendors to make sure that it fits what the customer is used to use. Going back regarding the parameters that our system measures, so we measure a variety of parameters of the heart, of the respiration. We're able to identify patients that are going out of bed, and we have a fall prevention mechanism that we indicate to the caregiver. And we also have a solution for patients that are developing pressure ulcer to prevent them by analyzing the motion, understanding that they're in their way to develop a pressure ulcer, and also a mechanism to help treating these patients. Our system also allows to monitor sleep while the patient is sleeping, full hypnogram of 4 stages of sleep, full sleep analysis with very important features here, as well as sleep score and the sleep apnea detection, identify patients with apnea-hypopnea index that are moderate or high.
Guy, I will have to ask you to wrap up just in time.
Just in time.
So we only have few questions and we are a little bit far behind. So I'll ask you to take them offline and we will move forward with Eyal Baum, Director of Strategic Account at TytoCare. Thank you so much, Guy. Pleasure to work with you.
Thank you.
Eyal?
Yes. So hi, everyone. I'm sharing my screen. So thank you all for joining this webinar, and thank you, Sheba, for having us to present our cooperation together related to COVID. And so I'll briefly go through Tyto's product and company, give you a quick overview, and then I'll focus more on our efforts and activity with regarding to COVID-19. So just as a background, what TytoCare is, so as Dr. Galia Barkai described earlier, we provide a full examination kit of basically 4 devices that all are connected, that basically enables the remote physician, any physician, GP, pediatrician, or anyone, to perform a comprehensive physical exam. And you can see here our tools consist of an otoscope, stethoscope, tongue depressor with the examination camera, and a thermometer. Basically a physical exam, meaning these are the 8 typical exams that we are enabling to do. So it's designated for primary care, for remote monitoring. For the COVID-19, definitely the lungs exam is, let's say, the most valuable, to monitor the lung condition, whether there are wheezing, bronchi crackles, or all types of indications in the lungs. But also throat could be some symptoms, measuring temperature using our non-contact thermometer. So basically, we enable the physician not just to do a phone or video-based interaction with the patient, but really to do the physical exam, and then to really take full decision and provide treatment remotely without the need to get in contact with the patient. In addition to the devices, we have a full platform that enables this very smooth experience for the doctor, for the patient. Keep in mind that Tyto's examinations are quite unique in the sense that those are qualitative examinations. So we need very good dependency on the platform and on the network, and to enable the physician to control the device. So we know we provide this full platform. Some customers using our full platform, and some customers using our integrated mode. You can see here, we've done integration with different telemedicine providers. We are now discussing with Datos this. So we know to go either as a full telemedicine solution or side by side with an existing platform or EHR. And of course, we provide integration with the medical record to provide access to all the data. And of course, the system is fully secured. Beyond the devices being FDA and CE cleared, they are also, of course, HIPAA compliant, GDPR compliant. Everything is encrypted end to end. Basically, in terms of the operation, we enable two modes of operation between the patient and the physician. One is the online mode, the live mode, where they are doing a video conference, and in parallel, the device streams the data in real time to the physician's web application. We will see that later in a video showing how Sheba has done this type of monitoring and examination in real time. And we also have an offline or asynchronous mode where we guide the patient exactly how to do those exams. Keep in mind, doing a throat, ears, lungs, or heart examination, those are examinations usually done by physicians, not by patients, not by the consumer. So Tyto is taking this, this makes us quite unique that we enable basically anyone, patients in different ages, to do this qualitative examination. And you can see here some demo videos that shows how using our algorithms and AI, we navigate and guide the patients, both teach them how to do using our academy, but during the examination, you see here an arrow guiding through the canal, and also an algorithm identifies the eardrum. So when we are guiding the patients, we need to verify that the data being collected by the patient will allow a diagnosis and not just, general video. So we need to verify the data is in a high quality. And same goes for the lungs. So we need to guide the patient where to locate it on the chest according to the lobes. And we give ongoing feedback on the quality of the sound. You see the green indication. It means our algorithm is identifying the respiratory sound or heart sounds in a good quality. Or otherwise, we'll notify or alert the patient, you're talking, you're moving, there is too much noise. So we accompany the patient and basically enable anyone to do this examination. In terms of products, we have the Tyto Home, which we use today with the home hospitalization or in general patients that do not want to come to the clinic now, with the risk of getting infected. So we see many consumers in the US, in Israel, in our partners, Europe and in Asia, that definitely the demand of families that don't want to come to the clinic. So with the COVID-19, this demand, of course, is increased. At the US, we are offering at Best Buy. Also, the Tyto Pro is also used within the hospitals by the clinical team, by the nurses, to do the physical examination and optionally get online with a remote physician. You see here a glimpse about our partners, about our customers, many health systems in the US, Europe, and of course in Israel with Sheba or with Clalit, which is Israel HMO. They have implemented Tyto already and offer it and using it in quite large scale with their patients. And each health system or insurance company using it in a bit different way. So our platform is flexible to support different kind of use cases. Okay, so regarding COVID-19, during the last weeks, and basically began when the Israelis came to Sheba from the Japanese cruise ship, the Diamond Princess. So we installed the Tyto in each and every room in the quarantined area. And since then, the usage at Sheba has expanded and was installed in also other departments within the hospital, in the urgent care, and in the urgent. So remote monitoring is definitely a typical usage we see at Sheba. And by the way, we also now used in almost all Israeli hospitals following Sheba, which are leaders in Israel. All the hospitals, so we see now 18 hospitals using Tyto with their quarantined patients in the hospital. In addition, some customers using it more in home visits for home care, that they are coming to the patient if needed, and of course triage in the ER or screening of patients with possible symptoms of corona, of COVID-19. They can use our app and device to get online with a remote physician. Of course, this is not a picture of a COVID-19 patient, but we see this usage with some of our partners. In addition, senior care, we see already hospitals in Europe mainly, in Switzerland, in Italy, in the US, that the elderly is much more vulnerable, of course. So we see hospitals that are doing remote care or long-term care to those senior facilities. And of course, quarantine sites, we will see it later now in hotels or other departments in different health systems. Regarding our partnership with Sheba, so we are working with Sheba in different usages as previously described. What I want to show here is a video that Sheba prepared, I think a nice video showing the full experience of Tyto as part of a live session where we see here Dr. Gadi Segal, who is managing the internal medicine and using Tyto to treat patients. So I will give the video and Dr. Gadi Segal to demo it in this video. I think it will give you the best impression of how Tyto is used within the hospitals and with home quarantined patients with the isolation kit that was mentioned. This is the home kit that was prepared.
שלום אורה, מה שלומך? עוד יותר טוב? אני דוקטור סגל, מהיחידה לאשפוזי בית של תל השומר, ואנחנו נפגשים עכשיו במסגרת המעקב אחרייך כחלק מקבוצת האנשים שיש להם קורונה. אני רוצה ברשותך למדוד לך את חום הגוף. אם תיקחי לרגע את הטייטו, את המכשיר הקטן הזה, את תוכלי לראות שעכשיו אני מדליק עליו תמונה קטנה. עכשיו נמדוד את החום שלך, בלי לגעת, יופי. מצוין, אין לך עוד בכלל, 36.9. עכשיו אנחנו עוברים לבדוק את הלוע. תפתחי פה גדול בבקשה. מצוין, אני לא רואה דלקת בלוע. הדבר הבא הוא להאזין לריאות שלך. תקחי בבקשה עכשיו את הסטטוסקופ ותחברי אותו אל המכשיר. תניחי בבקשה את המכשיר בנקודה מספר 1. תנשמי עמוק, פנימה והחוצה עם פה פתוח. פנטסטי. עכשיו לנקודה מספר 2. תנשום עמוק. מצוין, הריאות שלך ממש נקיות. את יכולה עכשיו לנתק את הסטטוסקופ. עכשיו אני שמח לבשר לך שהבדיקה שלך תקינה. אין עדות לדלקת ריאות. קצב הלב שלך תקין, סביר. אין לך דלקת בלוע, החום שלך תקין. את יכולה להמשיך את המעקב של היחידה לאשפוזי בית שלנו, ואני בהחלט חושב שתוך יום-יומיים תוכלי להשתחרר מהמעקב, ומאחל לך בריאות שלמה.
So this was the experience. last thing, I think I'm running out of time. So last thing I want to show is also we are now using by the HMOs in the hotels where patients with corona diagnosed are admitted. This is also something that has begun, where patients are coming to like kiosk mode, kiosk-like station and getting online with the remote physician. So this is another project that has started already. And as we said, it allowed the physician to monitor the situation of the lungs, of the respiratory conditions, and see if they are deteriorating. That's it. Thank you very much.
Thank you, Eyal. Again, I'm sorry. We're a little bit far behind, so I'll ask you to refer to the questions on the chat. And I'd like to invite Dr. Arik Eisencraft, Chief Medical Officer of BioBeat, to give his talk now. Please make sure 10 minutes.
Thank you very much. Thank you for this opportunity. We are happy to share what we are doing right now at BioBeat, aiming at transforming the healthcare by using remote monitoring. So BioBeat developed an end-to-end monitoring platform that enables the monitoring of patients wherever they are. We are using a proprietary sensor, which is based on an optic technology. We are using several light spectrums, and with advanced signal processing filtration in our algorithms, everything developed in-house, we can now monitoring a large number of vital signs, please. These signs include cuffless, non-invasive blood pressure, saturation, heart rate and heart rate variability, respiratory rate, stroke volume, cardiac output and cardiac index, systemic vascular resistance, skin temperature, one lead ECG, and more. And as you can see here, this monitor you see right here is showing my vitals right now. I have this small sensor attached to myself, and everything is transmitted in real time. We have CE mark approval. We have FDA clearance for several of the vitals. Actually, the corona outbreak caught us in the middle of submitting the next package for some of the other vitals, but we already have the clearance for cuffless blood pressure, heart rate, and blood oxygenations. We also follow strict regulatory demands for privacy and cybersecurity. We have two products. The first is a wristwatch, which is more for long-term monitoring used at home care facilities. It works for about 3 days, and then you need to recharge it. It takes about an hour, and you can continue with the monitoring. And again, the data is transmitted to the healthcare provider. We also have a patch, which is disposable, single use for up to a week, and it provides you all the vitals I showed you before. This is more aimed at pre-hospital and in-hospital care, and this is the device you are really focusing on when talking about providing a response to COVID-19 patients. As you can see here, the architecture covers everything. So from the device, the data is transmitted using Bluetooth to either a gateway or to the person's own cellular phone. And from there, through Wi-Fi or using a SIM card to the cloud, and from the cloud to the healthcare provider. The data is recorded, and you can look at each of the vitals, look at the trend and perform trend analysis, understand exactly what is happening now with the patient following him in time. It is accessible from any web platform. You can see here our dashboard on the lower right, and all the data is accessible. And actually right now we have started to collect this data, aiming to provide some physiological insights on how corona behaves in patients. For each of the vital signs, you can set the threshold alerts. So you don't only monitor the patients, you also get the alert if something is out of normal range. When talking specifically about COVID-19, we understood that currently there are several devices being used by healthcare providers, especially in patients that are not being continuously monitored. This actually increases the risk for direct exposure of medical staff, and there is a need for a simple remote all-in-one measurement solution, and this is why we've decided to move forward and introduce our system. So the BioBeat system is already integrated in actually 16 hospitals in their isolation departments, all on COVID-19 patients. And this is definitely part of the Israeli Ministry of Health, part of their effort to combat this pandemic. As I mentioned before, since you have a patch on yourself, from that moment on, the data is transmitted automatically into a web platform, or we can integrate it with EMR. And as you can see here in the picture, in several hospitals, this is already being implemented, helping to reduce the direct contact between the patients and the healthcare providers. We've now also started to move forward and allow this technology to help with home hospitalization. Here you can see an example of integration of our system into an EMR. So by that, we can really provide an end-to-end solution for remote monitoring. Thank you, and I'll be happy, of course, to take any questions.
Thank you. So actually, you have 2 minutes. Let's see if we have a question coming up, something we can refer to. If not, we will proceed with Eran. So Eran, please join us. Eran Or, founder and CEO of XR Health.
Hi,
Thank you,
everyone.
Eran.
Hi, everyone, and thanks for the Sheba team for this webinar. I'm the founder of XR Health, and we are a telehealth VR AR company. I'll start by giving you a very high-level overview about VR, because just to make sure that all of us are on the same page. When I'm saying VR, I'm referring to the headset, the gaming headset that all of you are probably aware of. But we are using those headsets as a medical device, basically, where a patient is putting the VR headset on, is basically immersed in different types of environments. And while the patient is inside VR, the clinician can monitor them remotely. And after every session, basically the patient and the clinician can see the patient results and status. We are a medical device company with FDA listed application. 8 of those CE will be completed within a month. HIPAA compliant platform. And we are, at least here in the US, we are a registered provider in 25 states already. And all the workflow and all the telehealth treatments here in the US are covered by CPT codes. The platform is basically separated to 3 major components. The first part is the clinician control panel. A clinician can access basically that software through via any PC or Android tablet, and moving forward the iOS devices. And basically the clinician can take control over the headset while the patient is back home putting the VR headset on. The clinician can see in real time what the patient is seeing, and basically conduct a virtual reality treatment for the patient. And after every session, as I mentioned previously, there are a set of analytics and reports that we can extrapolate from that session. We are measuring today response time, reaction time, smoothness of the motion, peak velocity, differences between right side, left side, breathing and exercises, cognitive skills, and a lot of basically a lot of data. What's unique about VR is it's a closed loop system. Once a patient is putting the VR headset on, they are basically an element in a computer generated environment where they are the only variable. And we can manipulate the environment and we can see how the patient interact. So that's why the data that we can extrapolate is very tangible, and clinician can use the data in order to make decisions. Basically, the patient himself is playing virtual reality games, and doing this COVID-19 epidemic, we are seeing that also have psychological aspects, because it allows the patients to escape and basically be somewhere else, and especially during the quarantine, that helps them on the psychological aspect. The patient himself has a mobile app, so they can also track their progress and see how they are doing. And as I mentioned previously, the clinician can monitor multiple patients across the board. Those are the use cases that we are addressing at the moment, all the way from stress and anxiety to physical therapy and cognitive rehab. And moving forward, we opened our platform for third-party developers. We already have 6 joined us. And the idea is that basically the VR headset will become a toolkit for clinicians and for patients, and they can pick and choose which application they want to use according to the specific need of that specific patient. Those are the applications that are currently FDA listed. We divided them to 3 major cohorts: motor function, cognitive, and psychology, behavioral health. And something that we are now rolling out because of the COVID-19. So one of the partners that we partnered with is develop basically support groups in VR. And the idea is that a clinician will basically moderate the support groups. We are seeing huge demand for this type of use case, especially for the elderly population, that are, a lot of them are now self-quarantined. And the beautiful thing about VR is that you actually feel that you're in the same room with someone, something that you can't do in a 2D interface. And the idea is that we will help people to cope with the isolation and the loneliness by using VR as a package. So during the last COVID-19 epidemic, we understood that as a whole, we can offer a package that is very attractive for a patient that is locked down. And basically what we did is we redesigned our application, and we now have a full package that is dedicated for COVID-19 patients, all the way from stress and anxiety, but also physical activity and cognitive exercises and the support groups. And here in the US, at least, we are starting to ship units across the country, and not just for COVID-19 patients, but all the patients that are now in a need to have a medical evaluation and treatment, but they can't go to the clinic or to the hospital. Basically, the process that we are doing here is a patient is enrolling. We are doing evaluation, medical evaluation, to see that one of our applications fits their needs, and eligibility to make sure that the insurance cover our services. Shipping the patient a headset, they're downloading a mobile app that guides them how to use the VR. Then they're scheduling a video call. During that video call, basically the clinician is conducting a virtual reality treatment. And from that point on, the patient is on their own while the clinician is monitoring them remotely. If you have any questions, this is my email. Feel free to reach out. All the data is on our website, including videos and a lot of other information that you'll be able to see there. Thank you.
Thank you, Aran. And we do have some time for questions. So I'd like to read the next one. XR Health, which kind of sensor has it got?
So we are using off-the-shelf VR headsets. Those are our sensors. So the VR device, that's our sensors.
If anyone else has more questions to the other companies, please type them now. If not, we will move on to summarize the session and Vinon and Roy give some closing remarks. So let's give you 20 seconds to type your questions. In any way, we will refer to them offline. All right. So, okay, not so many questions. That's okay, you can stop for now. I'm interested to hear about the doctor's experience in shifting from face-to-face to remote monitoring. I will encourage you to email us at Sheba and refer this question to Dr. Galia Markai, who had to leave us. For BioBeat, I have Arik with me, so I'll refer this question to him. Do you have devices for deployment in the US immediate use?
Yes, we do have, although in limited numbers, since most of the devices are now in use in Israel, but I do encourage you to contact us, and we'll be very happy to discuss that in order to allow deployment of our devices as soon as possible. We'll be very happy to help. Thank you.
Okay. People ask about get in touch with the Sheba team. So I'll ask Karen Biala to type our contact info. So you can contact us and we'll refer it to the right team member. Also, we will share the presentation and the recording session probably tomorrow or the next day. And the last one, let's see. And Karen, thank you for sharing. innovation@sheba.health.gov.il. Please refer any question to us and we'll respond as soon as possible. Let's see if there's a last question we can refer to. And with that, I will end it out to Inon. So are you planning to keep investing in these ideas for telemedicine even after the corona crisis? Actually, the answer is yes. We always invested in these telemedicine technologies and we'll continue to do so. This is exactly what allows us to scale and respond quickly in crisis, and we will continue to do so. So time is running out. I would like to refer this to Inon and Roy for some closing remarks, and we'll continue monitor the chat and get back to you. Thank you so much.
Thank you, Lital. I would like to thank you all for joining. Sheba, a global top 10 hospital, as well as the 5 companies that presented here are wonderful examples from the thousands of technological partners that you could find in Israel and that could hopefully help you to do better and more efficient job. Israel operates 44 economic missions globally. These missions are non-for-profit organizations that are aimed in bringing together Israeli companies and global partners. We work together with our partners in the Israeli embassies and the consulate, as well as the Chamber of Commerce. Feel free to reach out to us from the country that you're based to explore thousands of Israeli startups companies offering innovative solutions. In addition, feel free to visit our global website. I've just shared the screen. There's website of the Foreign Trade Administration of the Ministry of Economy and Industry. We have 44 Israeli economic missions. I would also like to thank Eyal, Lital, Galia, and Amir from Sheba for your partnership. Special thanks to my counterparts in the Israeli economic missions globally, as well as to the colleagues from the embassies and the consulates. Special thanks to our friends with the Organization of the Israeli Doctors of America for the help. Thank you all again. As for our first responders, friends, as well to whole medical ecosystem, we thank you for your commitment and hope that we will continue to be healthy and resilient as we look for ways to develop and expand our partnership. We're looking forward to have you in our future activities. Thank you all. This webinar has been recorded and will be submitted within a day or two. We will be happy to share with those that have not succeeded to join. Thank you so much.